Pretend this hand here is a pillow, okay? Like literally, there you go. See, so again, she turns that SCM off. She's nice and relaxed. Again, hand is a pillow. Do it. Good. Okay. So just kind of stretching through.
Oh goodness.
And that's all there is to it. You did phenomenal.
My internal child was crying.
Well, so long as the exterior adult is not.
Yeah.
Hi, Laura.
Hi.
It's very good to see you again. Laura and I are old friends from undergrad, I think. Maybe like 9, 10, 8, I don't know. Long time ago. We trauma bonded through taking calculus together, actually, for which neither of us now use in our daily career. So that was definitely a stressful learning how to limit on things.
Absolutely horrific.
It was a terrible
I hate it to this day.
Oh, God. But Laura's in today. She's a paramedic, which, as you can probably imagine, is a very physically and mentally strenuous job. And I'm just going to kind of let her take us through the conditions that she's kind of dealing with. So you were mentioning the knee pain there. Now, where is it in the knee that you do kind of feel that discomfort? Are you able to point to it here?
Yeah, so I think it would be like the more like lateral side.
So, lateral. Okay, good. I like that you're using the anatomical language. So you're feeling it on the outside mostly, and that's the same spot with both the extension and the curl, the leg curls.
Yeah, it's worse on the extension for sure.
Okay.
Yeah,
all right,
unfortunately.
So we can take a look at the knee today. We can take a look at the upper limb numbness on the right side. And sorry, did you say that you were getting on the left side too, or it's really just predominantly the right side?
Everything's predominantly, I guess, my right.
Are you right-handed? Like,
I am.
You're right dominant. Here you got a right knee problem, a right arm complaint. So.
Yeah. I guess it's my strongest side, but now it's my weakest side. So,
I fully understand. So, and then you also mentioned, like, you got soreness in pretty much everywhere because you're lifting constantly, whether that's for work or just recreational. Neck, upper back, lower back. Yeah? Yeah,
definitely. I would say a lot of the times if I'm trying to pick someone up, it's usually from, like, the floor or from a bed situation, and doing this kind of picking up rotating motion is where it really pulls everything, and then placing them back down, and it doesn't help when it's more of like a looser, like dead weight kind of situation.
It's definitely one thing to lift with proper form in the gym, and then it's another to try to lift with perfect form.
100%.
With somebody who's limp and 300 pounds or however much.
Yeah, exactly.
I can't imagine.
You gotta just do what you have to do.
And then any history as well. A lot of people, if they do have those strenuous loads, which then contribute to neck tension or pain. Any history of headaches or migraines at all, or?
Actually, yeah. So I have tension, migraines a lot. Usually, they only happen at most like once a month, but I usually have like a friend kind of just put their fingers here and like rotate it like really hard for a few minutes, and then it will kind of resolve a bit. But I usually add Tylenol.
What do you mean rotate it? What do you mean when you say that?
Like I just get them to like
dig
grip it and just like aggressively.
And you find that helps.
Yeah, just as hard as they can. Okay. Yeah.
Good news. Chiro can probably help a lot with that.
Oh, yeah?
Genuinely.
I've never had chiro done, so I'm actually pretty excited.
That's very exciting, and that very well might be in the thumbnail or the title now.
Yeah.
But, like, if you actually go watch other Laura, who I videotaped this, she had a history of migraines, and then when she started seeing me, resolved. No more.
Really?
So it's possible. Like, I'm hoping we can help you out today. Yeah. I think you're going to be a really good candidate because you're in need of some musculoskeletal care, and I know that you see a massage therapist, but as anybody on the channel is aware of, you're always going to benefit seeing more practitioners rather than just a few. So any questions before we kind of get into the physical exam then?
No?
Or no?
No, I'm excited.
Good. That's the right attitude.
Let's do this.
So are we. All right. Laura, to start, I'm going to ask that you bring your chin down to your chest for me. There we go. Okay, as far as you can. Now, does that provoke any kind of neck stiffness in the back here, or perhaps that headache that you were talking about earlier?
Yeah, a little bit.
What are you feeling?
Just a tension going up the right side of my neck. Right side.
Okay. Now let's actually turn your head forward. Good. Now I'm going to put a little bit more pressure. Does that make the tension worse?
No.
No. Okay, it's still the same. All right. I get you to look up, and I want you to look up towards the ceiling now. Okay. As far as you can. Anything in the neck?
Just a little bit of tension.
A little bit of tension. Again, we're going to do a little bit more overpressure. That's still okay?
Yeah.
Okay, good. Face forward. Are you sure you're...
Sorry, there was a bit of tension.
Hey, that's okay. That's okay. Yeah. I'm going to get you to check your blind spot. Rotate your head as far as you can to the right. Good. So Laura is actually getting to like 75 degrees, which is pretty impressive. And we'll get you to rotate your head all the way to the left now. And she can get to about 55, 60 degrees on the left side. So we have a little bit of reduction on the left side as compared to the right. I'll get you to tilt your right ear down to your right shoulder, please. Good. And I will do that. Okay, that's all right. And left ear to left shoulder. Okay, again, we have less lateral rotation to the left side, so interesting. She's definitely more locked up on the right versus the left.
Ooh.
What's your feeling?
Pinch.
A little pinch where?
Yeah, right here.
Right, okay.
Yeah.
Laura's not pointing to the very top of her neck. She's looking a little bit lower, kind of on the high middle ground, so we're looking at maybe like C2, C3, C4 levels, and I'll show a picture of that for you guys now. Okay, next up, I will get you said you have some lower back, some middle back, knee and arm stuff. Actually, we'll do a shoulder screen too while you're here. Why not? Now, you're saying that when you have this arm up to 90 degrees, where do you feel that numbness come up to?
Right now, it just starts in the fingers.
So it's already started?
Yeah.
Okay.
And it starts in the fingers, and then it just slowly moves. Like my fingers are getting really numb.
Give me
right
a
now.
thumbs up. Okay. Keep your arm there. Fight, 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 fight. So you still got strength there.
Yeah.
Give me a thumbs down. Keep your arm there. Fight, 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 fight. Good. Okay. I want you to bring this arm back. Oh, a little bit of a thing there. Fight, 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 fight. Numbness when you do this, like in this position?
No.
No? Okay.
No, I think we're okay.
And then, good. Okay. Relax. Shake it out for 1 second. Okay.
Okay.
Yeah. All right.
Cool.
We're going to do 3 additional tests on this side. That's going to hopefully kind of point me in the right direction of the numbness there. Okay. So the first one is I'm going to get you to kind of look downward and towards that right arm. Okay. And I'm going to take this arm. I'm going to find your pulse. Give me a second here. Found it. And I'm going to bring it back like so. And we're going to wait. You're going to take a big breath in. You're going to hold it. We're going to wait about 30 seconds. Okay. If you need to breathe, you can breathe, but try to hold it. Okay, anybody watching, this is Adson's test, and it's screening for something known as thoracic outlet syndrome, namely due to the scalene musculature. Okay. All right, you can breathe.
Oh, thank God.
Okay.
Wait, it's all numb.
So you're getting that numbness in the arm.
Yeah,
Okay,
it's all
interesting.
numb. Yeah.
All right, so we're going to do something similar. You're going to look down. You don't need to hold your breath for this one, okay? You getting the numbness again?
Yeah, my top fingers are, these ones are numb.
Okay. And one more. Turn your head to the left, please.
Okay.
Good.
Oh, goodbye. Goodbye, fingers.
There goes the real numbness there.
Yeah.
Okay. Good. Okay. So I was feeling Laura's pulse while we were doing that, and there was a little bit of reduction in how intense I could feel it as we do that, which is considered a positive test, and that happened across all 3, Adsons, Edens, and Wrights. So that points me in a direction that I will explain to her afterwards, but I'm just making sure to put on the camera now so that you guys got it. We're going to do one other test. Next test we're going to do for this kind of numbness we're getting in the upper arm is something called a ruse test. Now, do you remember the chicken dance when we were younger?
Yes. Yes.
I don't want to be a chicken, I don't want to be a duck type deal.
Yeah,
what you're going to do, you're going to bring your arms up,
Okay.
bend at 90, and you're going to do essentially jazz hands or chicken dance, whatever you want to call them.
Okay.
You're going to do that as fast as you can.
Yep.
I'm going to time you for 3 minutes, and don't worry, I'm going to speed this up on camera so you don't need to sit there for 3 minutes.
Okay,
but
all right.
let's bring your arms up
Okay.
now, okay?
Okay.
And I want you to do the
Like-
open and shut. Yep,
Okay.
yep. And I want you to do that for 3 minutes. Okay?
I look like a fool.
Yes, you do. Yes, you do. And you're going to look like a fool for 3
That's
minutes.
okay.
Faster,
You
faster,
know what?
faster.
How
I wasn't sure if that was 3 minutes
Oh.
or not, but we were damn close. Okay.
Oh.
How do you feel right now?
I'm loose. I'm tired.
Okay. So Laura was reporting weakness on her right side when doing that as well. I could see a very mild drop on the right side as compared to the left side. She was able to keep her left side up for longer. Right side didn't drop a lot. It wasn't a dramatic drop, but it was enough combined with the decreased pulse sensation we were getting on the side there for me to kind of have an idea of what's going on. And that's something known as thoracic outlet syndrome. I've actually made a video about this earlier. I can link the description. I can put the link up there in the corner, whichever corner it will be, but I'll be sure to walk her through the details of that as well as you guys too. So, right, so Laura, first thing I'm going to do here, okay, first off, you're getting kind of back stiffness. It's non-specific, like it's not like on one side versus the other, or is it more on right, or it's kind of just everywhere? All right, well, let's go ahead and do the staple straight leg raise that we do with pretty much every patient. You're just going to keep that leg relaxed for me. Keep that leg relaxed. I'm going to lift it straight up. You getting any kind of pain or discomfort in the back with this?
Of my back?
Yes.
No, not
No.
yet.
You getting hamstring tightness?
Oh, yeah.
Yeah, okay.
Yeah.
So Laura's still able to get up to about 90 degrees, which is absolutely awesome. She's able to get a negative on that test, and we like negatives in this, so unlike calculus, ours, I don't even remember if negatives were a bad thing in calculus, honestly.
What was it? What does it not exist?
The limit does not
The limit
exist,
does
and
not
that's true. Is that from, what's that from?
Stats. Is that stats? That's Mean Girls.
No, that's Mean Girls. That is Mean Girls, yeah. Okay. And there was no back discomfort with that, eh?
A little bit.
A little bit.
This one,
Okay,
yeah.
let's go ahead and try that again
Yeah,
one more time. I was too busy distracted by Mean Girls.
Yeah, it's right.
So you're feeling actually a little bit of a pinching in the lower back with that, eh?
Yeah, a little discomfort.
Interesting. Okay. Next up, we'll do our thigh thrust exam. For that, I'm going to get you to bend the knee. We're going to bring the leg over. I'm going to place my hand behind her back. Okay, it's going to go right there. And I'm going to push through any discomfort with that.
A little bit, yeah.
Okay, Laura was wincing again. Was that in the same spot as beforehand? Or?
Yeah.
Okay.
Yeah.
All right, and we're going to bring this one up here. And the same deal on this side. That's okay?
Yeah, no pain.
Awesome. Okay. Good. Okay. And it was right knee. Interesting. The right low back and the right knee and the right everything. And you're saying you're feeling this on the outside, kind of in this region here, or where when you get that knee pain?
It's there.
You believe it's there. Okay. So.
Problem is, I'm not very in tune with my body, so.
Yeah, it's okay.
Yeah.
That's why I have job security.
Yeah. Exactly.
Any discomfort with this movement?
A little bit.
A little bit.
Yeah.
Okay. Scale of 1 to 10?
Not bad. Like
Not bad.
2.
A 2. Okay. And we'll do that on the outside. You got some pretty noticeable bruises on this side. I hope you're everything okay? A strenuous job?
No, I broke into a bar the other night.
You broke into a bar.
Oh,
I was like, what does that mean? Like a gym bar? Literally, my head doesn't even go to a drinking bar. It goes into a gym bar.
There was a gate.
Oh, got
I
it.
had to get over.
Nope, nobody messes with paramedics. I love it. Like, paramedics and firefighters, you can just go do what you want, essentially. Like, okay.
Yeah, that's why there's that bruise.
Okay, well, thank you for sharing. So neither of those were really recreative of that knee pain that you're talking about, though.
No.
No? Okay. Bring this up. I'm just going to kind of have a seat on your toes here. I'm going to pull this. Any discomfort?
No.
No? Okay. Push that. Any discomfort?
Yes.
Where?
In that same
In the
spot.
back
Yeah,
again?
in my lower
Okay.
back.
So that's interesting because I'm still doing knee orthopedic exams, but we're getting recreation of the back pain. So it's entirely possible that her knee pain is actually, as a result, it may have been caused initially by trauma, but now it's persisting due to issues within her back. So where was I going with this? Yeah, the knee very rarely has a problem itself unless we're talking about an acute injury or literal degeneration within the knee. And that's because it's the communicator between the two longest levers of the body, okay? Like it is the connector between our femur and our tibia, which are two very long bones. So if there's an ankle issue or there's a hip or a low back mobility issue, it can very likely actually first present in the knee rather than in the site of offense at all. So that's kind of where my mindset is right now with her knee discomfort, that it's coming from her low back. It's possible that we could be dealing with the tendinopathy in the quad area as well, because she does kind of point to a more muscular region. So we could be looking at a rehab strengthening plan specific to either the VMO or maybe the vastus lateralis, which is a little bit weird considering the VMO is our primary tracking muscle for the patella, but I digress. That was a lot of science. My bad, guys. Okay. Next up,
I feel like
I'm
I
going to
learned
get
a lot
you.
right there.
That's good. That's really good. You're here too. You're supposed to learn too. I'll get you face down next. Okay. Laura, my hands are coming on your back now. Okay.
Okay.
So all I'm doing here is taking the time to feel kind of up and down your spine region and all the paraspinal muscles, including your traps up here, which are quite rocky throughout them.
Are they all in the right spot?
God, I hope so.
Oh, I hope so.
Mm-hmm. Yes, they're all in the right
Yeah.
spot. So some people are worried about this concept of like vertebral alignment, and that's a bit of a buzzword, honestly. It's kind of being phased out. Like, even if somebody's got vertebrae that are like here, and then here, and then here, which is totally possible depending on how severe some degeneration may be, like that person might be completely asymptomatic, meaning they have no symptoms whatsoever. So everything for you, you know, young, fit, like it's all in the right spot, Laura. Don't
Okay,
worry.
thank God.
Mhm. Okay, hands are going on the low back. Bottom of the spine is the sacrum. Just off the sacrum is our ilium, also known as our hip bones. The joint that connects those is the SI joint, the sacroiliac joint. Hands are going on those now, okay? So it was your right side that was uncomfortable with the thigh thrust test. This is your left side. How does that feel?
That's okay.
That's okay? All right, this is your right side. How does that feel?
A
Little less
tight.
okay?
Yeah.
Okay, all right, so feeling through the muscles. So Laura seems to have a bit of an SI joint restriction, which may or may not be contributing to the knee pain. So that's definitely something we're going to be addressing here is her upper SI joint. We'll adjust that in a bit, and we'll treat the region too. Muscle-wise. Okay. My hand's going on your front here, and you just fall right there. Perfect. Okay. That okay?
Yeah.
Good. This side, hands going on your front. Good, and fall. And then the last thing I'm going to check with you on your front here will be your gluteal muscles. Are you comfortable if I feel through the glutes?
Yeah, sure.
Perfect. Okay.
It's interesting. When you were on my right side, I could feel my body guarding itself.
Yeah, so could I.
Yeah.
With that.
And then on the left side, I felt way more relaxed.
That's another good
Yeah.
indicator that the problem is in fact on the right
Yeah.
side. So we'll be taking care of that for you 100% today. That being said, the glute musculature will also help to guard kind of that hip and SI region, which is why it's important to feel through to see if we have hypertonicity there as well, or tension. That's hypertonicity is the fancy word for tension. So glute med region, starting over here. And we got actually a moderate amount. And then the piriformis from the sacrum over to the greater trochanter. Is that okay? All right. Piriformis doesn't feel too bad. A little bit towards the distal end, but I think that might be more glute medius guarding, if anything. Now let's check the other side as well to compare. This would be the asymptomatic or the normal side. Glute med does not feel as engaged, which is a good thing. And piriformis up here, so. Nothing in through there. Okay. All right, good. So I'm going to start just by mobbing through, trying to induce a little bit of movement through all the back structures. This is an osteopathic technique. Osteopaths love their mobilizations, and hey, so do I. Okay. I'm going to get you to take a deep breath in, and all the way out, all the way out.
Oh.
There's a little one, but
yeah.
There's a lot of tension we're still getting through up there. Two ways to get these upper segments here. I'm going to try one way. If it doesn't go, we're going to try the other way, okay? I'm actually just going to move the microphone here because it's a little bit far from your head. And just keep that right arm still, okay? All right, you're going to take a big breath in.
Okay.
And a big breath out, and you're going to let me turn your head. Breath out, breath out, breath out.
Oh.
Ooh, no, that did not want to go that way. All right, let me turn the head. Very stubborn.
Sorry.
While it is your fault, that's totally okay. All right, breath in, and all the way out, all the way out. There we go. That, ironically, the right side actually really is better than the left, and the right side is where the issues are, so I'm pretty happy with that, if I'm being perfectly honest with you. Let's get you, I'll let you choose, actually. Do you want your neck examined and treated next, or do you want to get to the low back?
Low back.
Low
or
back.
Actually, well, no, we can do neck. We're already up here.
Okay.
Yeah, we might as well.
All right, I'm going to get you to lay on your back then, okay? Feeling through Laura's neck. Once again, it's the right side where she gets the tightness on. And she's got a little bit of joint involvement, but one thing I'm noticing is that she's got quite, especially as we get lower down there, we got quite hypertonic scalene muscles. Okay, now the scalenes are the ones that actually connect like dead to the side of our cervical vertebrae, neck vertebrae, and they go all the way down into our first rib, which is located in there. Okay. Now the scalene muscles are one potential source of thoracic outlet syndrome, which we kind of mentioned earlier. The others are the thoracic outlet proper and the pectoralis minor muscle in here. But I'd have to say that I think the scalenes will be playing a big role in the numbness that she's experiencing in that arm when trying to change the radio channel. So let's go ahead and do some MRT or myofascial release technique to try to calm down all of those structures. Especially down there.
Yeah,
that feels like a big
it feels like
knot.
You say it feels like a knot?
Yeah.
Yeah, I feel that too.
Yeah. What do you think it feels? What were you gonna say?
I thought I was gonna say knot, but or bulge or something.
Well,
like that.
yeah. Knots feel bulgy, right?
Yeah.
So that's definitely there. So to anyone watching, this is my standard myofascial release technique. I am pinning the knot or the target muscle, and then I am turning or stretching the muscle against that pin. A pin and a stretch. So that's for all the posterior neck musculature. For the scalenes, what I'm going to do is I'm actually going to get my thumb on that scalene structure and turn her head laterally, like so. Now, if that's too intense, you let me know, I'll back off. But
no, it's all good. I have no pain. No, well, actually, that's a lie. I have a lot of pain.
I was going to say, I think that's like, kind of why you're here.
Yeah. Oh, there we go.
That's a thing.
Yeah, that's a thing.
That's a big thing, yeah. All right, so because we are holistic creatures, it's never just muscle tension, it's never just joint lockups. It's always good form to treat both. So here I am doing the muscle component, and I think we're going to get into the joint component now, which is the neck adjustment. So drop, drop, drop. Now this is Laura's first time getting her neck adjusted. She's a little bit nervous, but she's putting on her tough face, as you can tell.
I'm petrified.
Absolutely terrified. So very safe and nothing to be concerned about whatsoever, okay?
Yeah,
so
for sure.
What I need from you...
To breathe?
Well, don't stop breathing, okay? That's ideal.
I'm
going to get you to turn your head as far as you can to the left for me, okay?
Okay.
As far as you can.
Oh, no.
You're good.
That's so scary. Wait. Okay.
You good? Okay, I want you to
Am I
pretend this hand here is a pillow, okay? Like literally, there you go. See, so again, she turned that SCM off. She's nice and relaxed. Again, hand is a pillow. Do it. Good. Okay. So just kind of stretching through.
Oh goodness.
And that's all there is to it. You did phenomenal.
My internal child was crying.
Well, so long as the exterior adult is not. Because that would be very upsetting.
Could you imagine?
I don't want to make my old friends
Waterworks.
cry. The new patients, sure, but not the old friends.
Yeah, I know.
Good. Okay, so now let's treat the left side. We're going to have to do the MRT again. I'm going to bring the microphone over.
Yeah. That wasn't as bad as I thought.
Good.
Yeah.
A lot of people can get psyched up about it and can think that it's this really big deal. But I mean, I'm in here doing this like 30, 40, 50 times a day. It's really no sweat.
Yeah.
Maybe don't get your neck adjusted by somebody who doesn't know how to do it.
Yeah.
That's a great way to hurt yourself.
No back alley.
Exactly. No back alley chiropractics,
Yeah.
okay? But like in here, no, you're going to be very, very safe and in very good hands, if I do say so myself.
I feel safe.
Good,
Yeah.
she said.
She said.
Frightened.
Scared. Petrified. I keep thinking, when are you going to do it?
Oh, I'll let you know, don't worry.
Okay, all right.
There's two strategies. There's the don't let them know so
Yeah.
that they're relaxed, and then there's the let them know so that they don't sue you.
Oh,
You know,
for
you
sure.
really
I was like, is he
you
gonna
pick
psych
whichever
me out?
one is best.
Is this one of those things where you count to 3 but you do it on 1?
One. Yeah.
Oh, God.
All right, let's go for the scalenes once again.
Oh my gosh, there's...
That's a little tight too, huh?
for sure. I feel like we're like slow motion wrestling right now. You know what I mean?
Kind of, yeah.
Yeah.
This contact does require having 3 hands, so instead I just use 1 hand, 2 hand, and peck to kind of like just pull you to the side there, because I've yet to develop a 3rd hand. Drop, drop, drop. Yeah, I know.
You haven't?
Worst chiro ever. All right, so we're going to go for that left side now.
Okay.
So it's the same thing, except it's the other side. I'm going to get you to rotate your head as far as you can to the right, please. Okay. You okay?
That's fine. Yeah. Oh, yeah.
All right.
Oh, yeah. Okay.
Laura's putting
All right.
on her brave face. This is good. So we're turned as far as we can to the right now.
Okay.
Good. And again, I want you to drop your head into my hands.
Yeah.
Very good.
Ooh.
There we go. That was
Nicely
2
done.
rounds. Thank you.
That was 2 rounds.
Yeah, there was one there, and I
Yeah.
knew that I could
Yeah.
feel more, so we went
Yeah.
for it. But
Wow.
very good job. That wasn't scary at all, right?
That wasn't-
The internal kid isn't even crying.
Yeah, no.
Awesome.
Now we're both calm now.
Good.
Now we're like strangely at peace.
That's usually the after response that patients get. Strangely at peace.
Yeah. 5 stars.
I'll take it.
10 out of 10.
I'll
Strangely
take
at
it.
peace.
Please leave that as a Google review. Okay, all right, good. Next up, we will do your low back. As we found earlier, Laura's kind of got a right SI issue going on, which is right here, so that's what we're going to be targeting with this. So what I'm going to do is I'm just going to kind of bring this arm here, and you're going to hold just like that. You're going to relax that head, okay? You're going to scooch your hips actually close to the edge for me. Thank you so much. Just like so, and then just relax. Good, good. Now, I want you to take a big breath in, and a big breath all the way out. Stay relaxed. Good job. Awesome.
Okay.
Now we're going to do the other side.
I feel like everything in my body just cracked.
That's because a lot of stuff did go with that one, and the mic got it all.
I was
Phenomenal.
like 10 cracks.
Arms just like so. We got to bring the hips much closer to this side here. Close, good, awesome. And for this side, I'm actually going to torque you out more. So give me this hand.
Yeah.
Pull just like that. Awesome. You're going to stay like so. Okay. This is because we're getting your lumbar vertebrae, not necessarily your SI on this side. So we need a little bit more rotation for that to be possible. So big breath in for me, all the way out. All the way out.
I was like 20 this time.
I love the reactions. Priceless. I'm going to start kind of up here in the trap area and get to it. So just while I'm getting started on this, Laura, usually this is the part of the video where I ask the patient to tell us something about themselves. And my go-to question is something about their career that they find the most rewarding. So you as a paramedic, I can imagine that there are several things that are obviously quite intrinsically.
Oh, God.
One of them, which is obviously probably saving literal lives, which is very rewarding. But why don't you, are you able to answer that question? Are you comfortable answering that?
Yeah, I feel like I have a bunch of answers. That's kind of hard. So sorry, what I find the most rewarding?
Yeah, the most rewarding about your job.
I don't know. I think like it's not only taking care of like the patient, but it's taking care of like their family. Like I try to make sure that every house or scene that I go to, I just making sure that everyone, however they're related, friends, family, acquaintances, they all are emotionally or like physically taken care of.
Mm-hmm.
So I think I know that like I like to know that at the end of my day that I've done like the best I can. I think in terms of like specifics of like something I find really rewarding is when like I guess like the most, if I'm on like been on scenes where someone's like dead or like they're choking and you see that like immediate reaction when you like you know, do compressions, you shock them and you like bring them back, and like I've had people where like a guy's been like he choked and then he died, and then after we do resuscitation, like 3 minutes later he's up and he's talking, and it's just, those are the crazy moments, and he's complaining about his chest and you're like, yeah, your chest hurts because I had to break your chest to do CPR to get to your heart. But like I think those are the most rewarding ones where they're like somehow up and talking and they've beat all the odds. Or rewarding ones like anyone involving like kids, or I find extremely rewarding. Being able to like to take care of kids or like take them out of an unsafe environment and provide them like a sense of emotional security. I find that really, really rewarding. So I don't know. There's too many rewarding things about my job. Like every call, it doesn't even have to be a serious call. It can just be like a simple call for like someone who's having like suicidal ideation or just emotional distress. Just to take the time to make them realize that like they have value and they're important, and like I see you, mm-hmm. and I don't know what you're going through, and so I can like, but I'm here to like sympathize and empathize with you. Mm-hmm. So yeah, I don't know. There's so many. I don't know.
Well, you just
touched.
Sorry. Hey, first off, you have nothing to be sorry about with that answer, because you touched on a lot of things that people, if they're lucky, will never actually have to deal with in their lives, right? But when stuff gets bad, like that's when paramedics go running that way. And I love that, yes, obviously the resuscitation and bringing somebody who is literally dead back to life, like nothing's going to beat that. And especially the kids too, who are the most vulnerable of the vulnerable, you make sure to secure that. But I love that you talked about taking care of the families of the victims too, like right off the bat, because of course the focus is on the person who is sick or injured or dying, for lack of a better word, right? But then you have all the people around them who are in their own way just as affected, that like very often just kind of get lost in the noise. And like the person who is the most affected, the person who is injured, they're of course going to get all the attention they need, right? But it's very nice to hear that, Laura, you don't do that. Well, you of course give the attention wherever it's needed, like you triage, but you see to all of the loved ones as well to make sure that they are taken care of and not just forgotten in that mess. So like truthfully, from me to you, thank you.
Well, thanks for saying that. Like, I don't know, it's, like you said, it's rewarding in and of itself. I do a lot of work with like seniors now, so like anyone 65 and up in like in Peel region, and just like realizing that like it's not just the patient, but it's the caregiver who's experiencing
the caregivers.
Yeah, the caregiver burnout.
Oh, believe me, I'm acutely aware.
Yeah?
Yes.
Yeah.
So that's why I liked that answer so much.
I feel like you're a caregiver. You know what I mean? Like you're caregiving for like your whole community.
Yeah, I'm a caregiver in that sense, but I'm also a genuine caregiver, like with my family.
Oh, yeah.
So it's that's why when you said you take care of the family, I did kind of smile, because it's like, hey, that's something that I'm dealing with personally as well. So, and she's helping people like me every day, so I hope I can help people like her whenever I'm needed as well. So,
you do great work. I feel like you're like, because I mean, not only are you healing like our bodies, but like I'm sure during conversations, stuff like that, you're also like healing like a little bit of their soul and like.
I try,
helping.
I'm joking about crying, but damn, I'm getting misty-eyed over here. Oh my god.
Yeah. I don't know. Are you rubbing something on my back? Something feels really nice right now.
Yeah,
what is that?
it's just kind of like a wax. Okay, and it just helps to glide. It doesn't have any kind of agent in it or anything, so there's no allergens.
Well, that feels great.
That. Good.
Yeah.
Happy.
Yeah.
So this is what I do. This is my version of sports massage. Instrument-assisted soft tissue therapy is what it's actually referred to. But it's very good at... It's almost like an alternative form of massage, but in my opinion, it's better at actually treating conditions. So when people have pain in a region that's due to a muscular imbalance or tightness, I'm able to usually take care of it pretty quick using these tools that, sometimes people have been unsuccessful with massage therapists in the past, but, that's no knock against the massage therapy profession, but sometimes, different techniques needed for different folks, so.
Yeah, this is pretty cool. So what's this bar called?
Well, this bar that I'm using now is literally called, no, it's not the I think it's literally just called the handlebar.
Oh, okay.
Like there's 5 different tools that I use. I really only use 3, but there's 5. They each have their own unique names, and they're really just for different regions of the body to make it more anatomically easy to target those areas. But sorry, did not mean to bump your head there.
So good, I didn't feel it.
Perfect.
Yeah.
Probably gotten hit by harder things before, so
100%.
yeah. Didn't you break into a bar the other day? Isn't that what you said?
I mean, it was Dundas West Fest, so I mean.
All right, so here, camera can see this, and Laura, you can't, but you'll see in the video. We got that petechiae showing up right here, okay?
Do your hands hurt after all this?
They did when I started, but I've kind of built up a lot of callus and strength since.
For sure. Because I feel like you have to use I imagine like your whole body for all of this.
Yeah, if anything, it's my back. So if anybody knows a good chiro, let me know. Because I can't treat myself. But no, the tools actually give my hands a rest. When I started, it was all just hands-on, and I lasted about 2 weeks before my hands were literally cramping up, and I was like, I can't. So now I can use these guys to subsidize some of the work, so to speak.
That's wicked. It's true. Where do chiros go to get chiro?
We have other chiros.
Yeah?
Yeah.
Interesting.
Yeah. I got some friends I graduated with that don't work too far from me, so I go visit them if need be.
It's the chiro club?
Yeah.
I'm excited to see this petechiae.
Oh, we'll get a picture of it and we'll show you, yeah.
Ooh, I feel like
That's a big knot.
what is going on there?
That's a big
yeah,
old knot.
It's like,
Yeah.
that's crazy. Oh.
Okay, we'll give that a bit of a rest. I went pretty intense on that.
No, sure, it's probably like gone now. Like.
Oh, it is, but still, that's you want to make an omelet, you got to break some eggs.
Wait, no, I had the omelet?
Yes, you will.
Oh my god.
You will be when you're done. That's okay. People love omelets.
I hope I'm fluffy.
What the hell do I say to that?
I
don't know what I say to
I
that.
don't know.
Oh my god.
The omelets are supposed to be fluffy if you do them right.
Oh god. Okay. Get the extra off you there, okay?
The what off?
There's some extra oil on you still.
Oh,
So that stuff does not get absorbed, so I will be just taking that off for now. You just stay relaxed, okay?
Mm.
Yeah.
Do you want to see a photo of your back? Do you want a photo of your back?
Sure, what's it look like?
Santina will take one, and well, she can do that right now. Yeah, here you go. Yeah, here, you can see it.
Oh, crazy!
Yeah.
Wow!
So that was the bulge you were talking about.
Oh my god.
Yeah.
That's nuts.
Yes, it is.
Cool.
All right, Laura, so how did you find all of that?
Pretty interesting, especially for like the first time I've actually had chiro done. So like I know, I kind of went in like a little apprehensive, a little nervous, but no, I feel great.
You feel good right
yeah,
now?
Yeah, I feel like limber. I feel like I should just, I don't know, I kind of feel like this needs like wave my hands
Yeah.
like that.
Off camera, Laura's just like, I feel
I
so
just
good.
feel so great.
I
No,
told her to
I do,
save
I
it.
feel
Like,
great.
That's a thumbnail. We were both just doing that right there.
Yeah, no, I feel wonderful. I feel like $1,000,000.
Good. Happy to hear.
Yeah,
Happy to hear. So to recap kind of what we've done, Laura's got what I believe to be thoracic outlet syndrome and a right SI syndrome going on, which I've kind of explained to her what that means off camera, and I will reiterate with her once the camera's off exactly what we should be doing going forward should she seek to continue treatment with me. Namely, something like this, a one and done probably wouldn't be the case. We'd need like a treatment plan of maybe 4 to 6 weeks, 2 times a week about, backing off until eventually we hit a will call basis. So we're never going to do one of these big, long, I'm seeing you for the rest of your life 3 times a week type deal, because quite frankly, that's just untrue. That's unneeded, and if that's the case, it's not working. But I'm confident that we'd be very capable of taking care of this complaint and making her feel much better and helping her out with anything else that pops up physically with her paramedic job. So do you have any closing thoughts or closing remarks for today? Or
No, I just I think this exceeded my expectations. Like I said, it's 10 out of 10, 5-star.
I'm gonna ask you for a Google review
Yeah,
after
for
this. So
sure.
that's Laura. Thank you, Laura, for coming in.
Thank you.
for being
Yeah.
you and your service as a paramedic genuinely, because
Oh,
we're made better because of your efforts.
Yeah, thank
so,
you for having me today.
Yeah, otherwise we'll.
Yeah. Thank you for having me
Okay.
today. Yeah, I feel great. Yeah.
Good.
But yeah.
We'll end on a high five. That's
Yeah,
how we
high
do it,
five.
okay?
Yeah.
Boom.
Don't forget to like and subscribe.
Thank you, Laura.